Hi, everybody. My name is Nicole Cohen. I am a managing director at Accenture, and I am thrilled to have Laurie Cooke here with me today. Hi, Laurie.
Hi, good to be here.
Great to see you. I thought I would start by just giving you a chance to open up and give a bit of an introduction before I sing your praises, of course.
Oh, well, I'm going to like that. I'm Laurie Cooke. I'm the president and CEO of the HBA, and I've been part of the organization in this chief executive role for coming up to 15 years. Hard to believe, but it's such a passion that I have to really be bringing women across the globe together with a mission which is simply to advance women that are in the business of healthcare. And what could be better than that?
I can't think of anything. And here I'm going to start a little bit of singing the praises before we get into some interesting, I hope, questions to learn more. But I do want to say from personal experience, share with you just a bit of my HBA experience.
Okay.
And let the listeners or viewers know from a non HBA CEO, but just someone in the industry, a perspective. So a number of years ago, I was selected amongst a group of amazing women to be a luminary in an annual event that's where women are honored across the industry. And the event was in New York City, not too far from where I live on the East Coast. And I headed into the night before kind of cocktail hour. And as many of you can imagine, when you walk into a room filled with people who are chatting and laughing, you kind of your eyes go right to the bar. Where can I just go and just have something to do for a few minutes while I kind of get my bearings and figure out, are you going to interrupt a conversation? Do you go up to people? No sooner did I walk in the room with just an ounce of nerves, like, oh, here we go, with just a group of amazing people. I was immediately welcomed into the room by a number of people introducing themselves, reading my, name card. Where do they work? Where do I work? Whether they were a competitor of mine, or companies or competitors, I should say, or not. Immediately welcomed. There was a warmth in that room that I've not seen before. It was almost, I would say, a magical experience. It really was. And that was a few years ago. And I continue to tell people who are in the industry or work for the company where I work, these events have the secret special sauce. There's just a camaraderie, the best way to describe it is the word warmth, just a welcoming spirit. And I wondered if I could, ask you, what is that secret sauce? Like, what?
Oh, well, that is HBA's radical hospitality.
Yeah.
It is something that was incredibly important to me as I had gone through my career. And one of the things is you don't really have an environment where you have other women who care about your success. I mean, truly care about your success. And so we create our events with that in mind. Someone's walking into the room, they don't know you, and you want to embrace them and figure out how can you help. And because they're going to help you, you're going to help them, and a rising tide raises all ships. So this is really important for women, especially if they're in a career where they're really busy and head down working. And they go home to start their second job at home as family caregivers, etc. And to walk in a room and be seen, I mean, really be seen, it makes me have chills still to this day. And I've been doing this for 15 years. And it's true, and it happens, it's real. And we want more people who care about that to join, right? That's what we're about.
Yeah, well, you had me at hello. So I was impressed from moment one, and continue to be impressed. Maybe you could share a bit more. I mean, it definitely comes across your passion for supporting women, for women being present for other women, for the advancement. And can you talk to us a bit about your passion about that and what drives you?
I guess for me, it's about fairness
Mm.
on one hand and health outcomes on the other hand. I started out my career on the medical side. I was a microbiologist, then I'm a pharmacist, and worked in the pharmaceutical industry for quite a few years doing global development, trying to develop antibiotics that would save people's lives, right? So it is critically important for me that we are doing just the best healthcare we can practice. And I do think, from the perspective of better healthcare, if we have more women, more balanced conversations, and when you look at the end customer, which isn't that what all businesses should do, is look at the customer. Do we understand the customer? The customer is a woman. At least 80 to 85% of all healthcare decisions are being made by women. And so you really want to have that represented on the side of the people developing, marketing, supporting products, as well as just getting more women into clinical trials so we better understand gender differences, et cetera. So one is about better health outcomes, which I do think is going to happen with more women at the table. But the fairness, that equity is just, it's been in me since day one. It is so important to look after others. We have a responsibility. You want to leave, this world a better place than where you came into it. So for me, when I look around and I see more men at the senior levels than women, when I know it's at least 50% of women that came into that talent pool, it doesn't make sense. Something is not fair. And when something's not fair, I want to fix it.
Oh, I love that. And how do you think we're doing? Like, how do you think the industry's doing so far?
Okay, I'll give you my positive.
I love positive.
Okay, it is changing. It is changing, and I'll give you an example. The HBA, at first we were about, oh, let's really be there for each other, and then it became more, let's help fill in the skill gaps and confidence gaps that women had, and then we were like, wait a minute. There's nothing wrong with women. We're trying to fix women like that's the problem. No, the problem is that there is just a uh, systemic barriers that are built into organizations. And if you think back, organizations were built by men for men, and that's not a criticism, it's a reality. So it's built on, a man had the wife at home, looked up to the kids, it didn't work. And so the way things are built for what a leader looks like, and you need to have global experience, so you have to pick up and move, and you can do all of those things when you have someone at home. So things have been built with a man in mind. That's the norm, right? So we have to change that norm. So we put together something called the collaborative, where companies join because they really care and they agree they're going to put data on the line, they're going to measure, they're going to hold themselves accountable, and together we are collectively trying to solve those systemic issues. And within a very short period of time, this set of companies on average is 12% more women at all levels than companies aren't in our collaborative. So it can be fixed. What it takes is a company that says from the top, we are going to fix this. Really meaning it, we're going to fix this. The bad side of it is, oh my goodness, it's going so slowly. I mean, seriously, this can be fixed much faster. I think we think it's much harder than it is, and it doesn't have to be that hard. So I am positive. Things are happening, and we do have solutions in place. We just have to, get the right people on the bus.
Yeah, sounds good. I'm proud to work for a company that has done a lot of what you said. I'm actually very excited, putting some measurable goals. I won't even call them a target. They are measurable goals. And I think you're right. You see change when you define what good looks like and you measure against it and you hold people accountable. And it
And
really is a shared goal.
Exactly, and you want the best talent, don't you?
Yeah.
So you're not going to get the best talent if you're only looking at 50% of the talent pool.
Right.
So how are you going to attract that other 50%? Well, women are getting a whole lot smarter about what to ask when they are interviewing to join a new company. And your company is going to be much more attractive to bring in the best and the brightest. So I think there's an incentive there as well.
Yeah. And in your career journey, I mean, you said it yourself, HBA, it's global. Do you see differences in how different parts of the world are approaching?
Oh, I do think that the way we talk about it perhaps is a bit different.
Hmm.
The way we measure it, whether there are regulations in place for it.
Interesting.
I do think that that is different. However, I do think we finally have the business case for change
Yeah.
has been institutionalized, that generally speaking companies get. I will be better off financially in front of my stakeholders, in front of my customers, if I have a more gender balanced team. You hear companies now say, when a consulting company comes in, any kind of vendor, potential partner, when you look across the table and you see all white men, chances are they're not going to get the job anymore. And
Hmm.
isn't that's a tremendous change
Yeah.
from what it used to be? So I'm really pleased about that. I do think there is perhaps a difference in culture in your sort of daily life that feeds into what the work life
Right.
is like. When we lived in New Zealand, they had a much stronger um, uh, love of and respect for your physical side of the house, right? So people were much more physically active and their home life and their family life. So that balance really seemed to be there, and I really appreciated that. In the UK, I think it is. There seems to be less women working. I think less women worked in New Zealand, more women worked in the UK. But when you got to those higher levels, there weren't as many women,
Right.
right? Then you move to the US, where it appears very much, at the front of things and gender balanced, etc. But we still have a lot of bias here.
Yeah.
But I think the piece that's not in the US is we do not have work-life balance. And that makes it incredibly different, because women have, how do you balance a job that never ends? You're always, connected, and you're trying to be the best mom you can be, the best partner you can be. And that's hard when work just doesn't let go.
Yeah.
So there's good things in all the different places we lived.
Yeah, and I have to say, globally, as a global workforce, if you will, we've all been confronted with the impact of the pandemic on our
Mm.
family lives and what it truly has meant for the work-life balance. Even if you thought you had figured it out 12 months ago, you had no idea what was about to cause major disruption to that equation, or that balance, or that, the way that you were approaching how you were making it all work. And so, and I have to say, and I'm not just saying that this because who you are, but the HBA gives this great opportunity for women in all parts of healthcare at all levels to look at each other, to turn to each other for examples, or for just a shoulder, even if we're still all
Right.
figuring it out. So how would you advise, especially some of the women in healthcare, perhaps just starting out or a few years in, how might they tap into HBA, and what can they expect from that network?
But when I first found the HBA, my regret was I hadn't found the HBA
Mm.
earlier in my career.
Isn't that the truth? Yeah.
I just, the access to role models that went outside of my company. So it got outside of the cultural norms that a company might have, and you start to see how broad leadership can look, different leadership approaches, and what you should ask for, how you should, how to get ahead, and when should I think about going for my next opportunity? How do I do it? How do I negotiate for salary? Like the whole piece. but it's the role models that even make you realize you didn't know. Like you thought you knew, right? You didn't know. And so the role modeling, I think, is so important. And if you, and I encourage the HBA, but I truly say you should belong to an association. One of the biggest things is you meet people, they meet you, and that's how you get jobs, right? So not only is it role models, it's someone who can knock on the door, open the door, and introduce you to someone else. And that is so important when you're early in your career, to have that infrastructure, that network.
Yeah. Oh, I completely agree. I love what you said. I think belonging to an association is great. I'm just going to push the HBA for those who will
Thank
listen to
you.
me. Of course, I'm telling you, I've seen it in action. There's nothing like it. Um, so I wanted to also, you know, get to know you also personally, and learn about your leadership traits. And I've seen some of your other discussions and have gotten the chance to learn so much about you. But I'm going to approach this question a little bit differently, which is outside of the business world. Where might you, so in your personal experiences, hobbies, interests, what might you have learned that you took in to the business world that has helped shape you as a leader?
Wow, that is a wild question.
That's what we do here.
Okay, all right, I'll roll with it.
Yeah.
Um, do you, we had this wonderful, wonderful leadership conference where we brought in this maestro who did who taught leadership by he took the Philadelphia Orchestra, which he did not know. We just invited the orchestra and he came in and he demonstrated live how in an orchestra everyone has a part, no matter how small, a teeny piccolo to, the massive, bass or what have you. And he demonstrated firsthand. I do think I learned a lot about leadership. I was in an orchestra. I played clarinet, and the things that you learn about tenacity, you have to practice, right? You just have to do it. You have to put the hours in. You have to be collaborative, right? You need to be there for your team member. And then there's competition because the way you move up is you have to challenge the chair that's next to you and you go into a competition to see who plays better. And that was, it reminded me when we were in this conference thinking back to what it was like being in that chair playing. And it was just when you are making music with other people, it is magical. And that is what happens to me when I am in the workforce and you are working with team members and it is magical when stuff is moving, right?
Yes.
It's hard to replicate, but when you don't have it because
Yes.
you don't have that magic and everything just feels hard, right? So that's what I think that's what I would say.
I love it. And you have definitely, as I said, created magic with the Healthcare Businesswomen's Association. For us, for the women out there in the industry, day in, day out, you've created a place for us to learn, grow, and really support each other. And the sky's the limit. So I want to say thank you. Thank you for spending these minutes with me, this time with me. I hope to speak with you again soon, Laurie.
Thank you so much. It was such a pleasure.
Me too. You take care.
All right. Bye.
Bye.